Our panelists for this session are Dr. Meenu Handa, Clinical Director, Fertility Cloud9 Hospital, Gurgaon. Dr. Handa brings decades of hands-on expertise in female fertility and patient counseling. Her work focuses on customizing fertility preservation protocols, particularly for high-risk and time-sensitive cases. Our moderator is Dr. Sunita Arora, Head IVF and Senior Consultant, Fortis La Femme, Chairperson ISAR Delhi. Dr. Arora is a distinguished leader in fertility medicine with a deep commitment to academic dialogue and patient-first approaches. As chair of ISAR Delhi, she has championed preservation, awareness, and integrated fertility literacy into clinical practice. We also have Dr. Rimi Singla, Director, Radiance IVF and Radiant Super Speciality Hospital, the President of the Mohali Obs and Gynac Society, and the Secretary of the ISAR Chandigarh chapter. We have Dr. Shivani Sachdev Kaur, Director, SCI IVF Hospital. An internationally recognized fertility expert, Dr. Shivani has worked extensively on fertility preservation, particularly in oncology-linked and socially elective scenarios, combining global exposure with deep-rooted Indian clinical insight. We also have Dr. Pooja Mehta, Head of Department, Fortis Bloom IVF Center, Mohali, and Chairperson, ISAR Chandigarh. Dr. Mehta is among the leading IVF clinicians in North India and a strong voice for bringing fertility preservation into routine conversations, whether in cancer care, PCOS, endometriosis, or social contexts. With science, ethics, and empathy on the table, this is a conversation that's both timely and transformative. Please welcome the ISAR Fertility Preservation Panel. Can we have a huge round of applause for them?
A very good evening to all. At the very outset, I would like to thank ISW Council for having us here, and thanks to Dr. Amit Patki sir, President ISAR, who gave us this opportunity at Crown Plaza today for celebration of World IVF Day. And I welcome Dr. Pooja, Dr. Meenu, and Dr. Rimi Singla on the panel. And we are going to talk about fertility preservation. So I got a call from Nanika, to be very frank, that it should be understandable to general population. So we have made it very, very simple and no hi-fi things. We are just going to tell you, how we go about fertility preservation, what's the right way. Yeah. So what is fertility preservation, first of all? So fertility preservation refers to techniques used to save or protect a person's ability to have children in future, particularly when facing treatments or conditions that may impair fertility. So if we broadly see these methods, when we say fertility preservation, what all does it involve? So it may involve freezing eggs, it may involve freezing sperms when it comes to male fertility preservation. It may involve freezing embryos, or it may involve freezing ovarian tissue or testicular tissue. So that's very, very understandable thing. So now let's come to common indications of egg freezing, first of all. So I would like to know this from Dr. Pooja. Can you take this up? What are the common indications of egg freezing in our country or worldwide?
To start with, I would say that egg freezing started for oncology patients, basically for cancer patients, where when patient diagnosed with CAs, where they were counseled for egg freezing so that their fertility is preserved, because later on they might be going for chemo or radiotherapy. Then over the time it started getting evolved, and they started that patients, I mean ladies who've not found their Mr. Right, like social egg freezing started, where if they've not found their Mr. Right, then they started freezing their eggs. The best time to freeze eggs is before the age of 35 years. That is the ideal. Especially we do fertility preservation also for patients who have endometriosis. At times, if the girl is not yet getting married, in those patients also definitely we can do fertility preservation. And as fertility preservation is not only for females, it can be done for males also, where we get a lot of patients with oncology patients, or patients who have varicose and all those patients, or some patients who have to undergo vasectomies. They go for fertility preservation beforehand, and then they can think
And
ahead.
even Dr. Sunita, I mean, in today's scenario, many girls who have the recurrent cyst, and she's a well-educated girl, she's eager to know about the egg freezing, and she herself come to the OPD, no ma'am, I want to freeze my eggs. So scenario is being like, the indications, what would I say, the awareness is increasing, and many girls are aware of what is the importance of egg freezing later on in years.
I think I would just like to add that from the therapeutic point of view, we started with a big C as the cancer, as Dr. Pooja rightly mentioned. In Gurgaon, we have also seen that a lot of patients who have, from the cancers, it went to a lot of other diseases, like especially autoimmune, where we are giving immunosuppressants, where their fertility could be at stake. And many times, genetic disorders is also one of the reasons where a person could be at risk of going for a premature ovarian insufficiency. Even those patients, apart from social causes, therapeutic and social are now a very, very important.
Yeah, very well said. So just to complete the list, which my dear panelists have already enumerated, oncofertility. When we say oncofertility, this means fertility preservation in cancer patients. So why so? Because they may need radiotherapy, they may need chemotherapy, which is going to be toxic for the gonads, is going to be toxic for the ovaries, going to be toxic for the testes. So that's why we want to preserve fertility beforehand, before the girl or the boy goes into the chemotherapy or radiotherapy treatment. Then the genetic problems like, genetic syndromes, Turner's, Fragile X, all these are known to have declined fertility before time. So that's why fertility preservation is an answer in that case. And as Dr. Meenu just said, autoimmune diseases. Then there are conditions where the fertility reserve will go down before time, like in cases of severe endometriosis. So this awareness is very important. If the girl is completing her family on time, perfect. But because of some reason, if she is not able to, kind of become pregnant, it may be any reason, it may be career, it may be not finding the right partner right now. So these are the patients, these are the girls who should know that fertility preservation can be an answer in those cases. And of course, social egg freezing, which we talk about so much, is age-related fertility decline. Then transgender individuals, this is again, something which is very, very talked about these days, and some legal, ethical and social factors. So Dr. Pooja, can you just throw some light on this? What technological advancements do you think was a breakthrough in process of egg or sperm freezing? Because earlier we used to have slow freezing. So what is it which has really brought in a new light?
Yeah, basically slow freezing was a process in which there was a lot of ice crystal formation. The chances of embryo getting destroyed, was much higher. So we came up with vitrification technique, which is again a fast freezing, where the crystal formations are very less, there is less damage to the embryos or the oocytes. So vitrification is the best advancement which has come up, and which is really good, and definitely it helps in getting a good revival rate basically.
And this
Perfect.
miotic spindle, miotic spindle.
Yes, right. So for my audience, so many of them are already IVF specialists sitting here, so they don't need this to be re-emphasized. But for people who don't know about freezing, social egg freezing and all those things, so there is something called as vitrification, which is now not new anymore. It's been years since when vitrification has come into IVF labs, and this is a technology which leads to a sharp drop in the temperature. If you look at this graph, the blue one shows vitrification. The temperature drops to -190 degrees Celsius over seconds. So that's why there is no ice crystal formation, and there is something called as meiotic spindle inside the eggs, which is very well maintained when we vitrify the eggs. So since when vitrification has come, it's like a boon in the field of IVF, and the labs are doing much better as far as egg freezing is concerned. So Dr. Rimi, when we say biological clock of women, so what does it exactly mean?
Basically, if we'll talk about the social egg freezing, girls, if they really want to freeze their eggs, ideal age is below 35. Around 30-32, they can freeze their eggs. And biological clock, everyone is saying like with age and with aging, your ovarian reserve is definitely going to decrease. So as per biological clock, as soon as girl is aware, she should get her freezing done.
So what is biological clock? Biological clock refers to natural decline in fertility with age, particularly the decreasing quantity and quality. So this knowledge is something which we give to our girls who are coming to our OPDs, that they should either produce kids in time or they should think of freezing their fertility. My slide is not moving somewhere. Yeah, so let's take this case scenario. Dr. Meenu? Yeah, so we have Miss X, who is 34 years, she's an entrepreneur, doesn't want to marry, career-oriented goals, determined that she is not going to marry in next 4 to 6 years, but apprehensive that she may have difficulty conceiving in few years. So she's coming to you. So what is your answer, your take on this case? Or in other words, what are the various fertility preservation options in unmarried girls?
Absolutely.
So and what is the ideal age?
So this is a very important, this is a time when we are doing a social egg freezing. And this is one of the social causes where egg freezing can be taken into account. And as we just said, that biological clock, basically for females, we are born with set number of eggs. Eggs are the cells which are never produced in the body. So after 35, as we just mentioned, that there's going to be a sharp decline in the number as well as the quality of the eggs. So yes, social egg freezing, if she's desirous, she should be freezing, she can take that option, I would say, to freeze the eggs. The sooner the better, less than 35 years, she should be doing the egg freezing. But yes, at least counseling with your fertility specialist, checking your fertility tests, and then taking a very informed decisions. I think right now what we are facing, all of us, is all the Gen Zs who are so much reading about egg freezing. I think less than 31 years, they are coming in, walking in the clinics and saying we would like to freeze the eggs or the embryos. They don't have, that kind of a stigma. But these are the people that we are trying to tell them, okay, hold on, you need to wait. But 30, 35 are the people where they really need the counselings, and yes, they can take this thing. So ideal age would be less than 35. That would be my
right. So at the same time, being fertility specialist and being gynecologist, this is our moral responsibility to explain this to our girls, that it is not a blanket statement for all. Like we should motivate our girls to become, complete their families on time. But if that option is not existing, in spite of your good counseling, the situation is like that, then ideally freezing of gametes should happen at right age. That is very important. And why it is preferred at younger ages? Because as the age advances, all of us know the risk of chromosomal problems, genetic problems, that sharply rises. Risk of Down syndromes, if you look at 45 years of age, it can be as high as 1 in 20. Then similarly, the chances of miscarriages in older eggs is more. So if a girl is freezing her eggs at 32 and she's coming to use them at 40, that egg is as good as an egg of mother at age of 32. Similarly, the risk of stillborns and all is higher when the egg is of higher age. So that's why it's so important to freeze the eggs on time if you are wanting to do so. So, Dr. Rimmi, can you take up this one? So, when a girl is coming to your OPD and she's asking for, ma'am, how many eggs should I be freezing? If she's 30, she's 32, 35. So, what is your number you are going to give to that patient?
Yeah, first we have to take her like AFC count by doing one ultrasound, and second is the AMH level. But I would say, as per our guidelines, minimum number of eggs should be around 12 to 15 eggs. I think she should be able to freeze her eggs for her like further on pregnancy.
Right. So what we need to understand is, as the age is advancing, the number of eggs, oocytes we will be needing to give one live birth is going to increase. If you look at this paper by ISRM, that says that if you want 70 to 80% chance of a single live birth, then you have to freeze at least 15 to 20 metaphase 2 oocytes in that girl if she is less than 38 years, and the number can be as high as 25 to 30 between age of 38 to 40 if you are you have a goal of giving a live birth up to success rate of 65 to 70%. This is a good success rate, isn't it? So if we want to achieve this success rate later at 40 years of age, or when she's freezing at 32, you should have around 10 to 12 minimum, 15 eggs at 35 and so on. So these these papers have concluded after so many researches. We just can't say that we have frozen 3-4 eggs and you are good to go. So that number is also to be taken in consideration. So what is the implication? Implication is that particular lady, that particular girl may need more than one cycle of egg pickup to reach at that number, right? So that is also equally important. So
and for that, like many girls, if you are doing a counseling for that girl, if we will not be able to get as much as eggs, and she's definitely, and she's eager, no ma'am mere ko to freeze karane, and she's ready for the next cycle also for ovarian stimulation.
Yeah, your counseling has to be like
because
that.
counseling is must when we are taking up for ovarian stimulation ke hame kitne eggs milenge, we don't know.
Right.
But still we have to do a counseling.
And at the same time, I think the counseling for just not the eggs, but we are looking at M2s. We need to really
Yes.
tell them that we are looking for
we have
matured
to,
eggs.
हाँ, कि M2 कितने मिलेंगे उसमें से, that we need to.
Absolutely. So what we conclude is, if the lady is sure she has to preserve fertility, earlier the better. We can always look at ovarian reserve by looking at AMH, which is blood test, blood marker, and antral follicle count, which is seen on ultrasound. And roughly by that ASRM paper, we can say between 30 to 32 years of age, 10 to 12 eggs, between 35, around 35, around 15 to 20 eggs, but at 40 you will need around 25 to 30 eggs if you are looking at around 70% chances of giving a live birth to that girl. Now the question comes, when the girl is coming to freeze her eggs, she will have this question, am I good? Will it give me at par success rate as compared to if I'm becoming pregnant at that time? So, Dr. Pooja, can you take up this one? So, we have ample data which says...
See, the thing is, first of all, a thorough counseling of the girl is very, very important. As rightly said, age really matters. See, I had a girl of 46 years of age who came to me the other day saying that she had to freeze her eggs. I tried to counsel her. She's like, at least एक भी मिल जाएगा तो भी आप कर लो pickup. It's so difficult to explain it to them. Like the chances of getting a good embryo is very, very hard in these patients. So it's the counseling part plays a very, very major role. So basically the number of eggs really matter at an elderly age group. What was your question?
So, yeah. So
like thawing rate, we have to counsel her. Like
Right.
what will be the thawing rate, like percentage, like around 60 to 70% is thawing rate.
Yes, absolutely. So if provided your lab is good, your vitrification program is good, the lab in which you are going to freeze your legs with a good vitrification program, the thawing success rate are quite good and are comparable to using the fresh eggs.
I think also one of the reasons where younger patients, when you freeze a better quality, better number of eggs, will definitely be at much better position than when you are trying to conceive at a later stage.
Absolutely.
But even now we say that embryo freezing is better than egg freezing. So comparatively. Always we say that to the
But it's
patient.
unmarried.
This is an unmarried girl, definitely, but otherwise I am
Right,
saying,
right.
definitely.
So now, is the procedure different than IVF, or is it same? So just in 2 lines, can you just
Till the time the egg reaches the lab, it's the same. Of course, later on the procedure changes. The procedure is very simple. It's a painless procedure. We have to give injections for 10 to 12 days. There are no cuts involved. Actually, that's how we counsel the patient. The pickup is done through ultrasound TVS guided. So it's quite a simple procedure.
And on the
I
same
think
day, the girl is going to know how many mature metaphors
Exactly.
to eggs she
Yeah.
has got.
Yeah.
So now this girl gets married, she comes with her partner, then what is the next step, Dr. Meenu?
So when we have done an egg freezing for a woman for this particular case, then definitely as per the law, she has a husband, so the husband's semen analysis would be done, and then they'll proceed for the ICSI or the IVF procedure depending upon what's the count of what is the semen analysis. And yes, once the embryos are made, then they can be transferred back. So that's an IVF procedure where they'll have to.
I would like to say normally for a oocyte, frozen oocytes, we do only ICSI.
Yeah, because
We
they are
would not-
denuded
yeah,
eggs, so you have to go for ICSI.
ICSI only,
You make
yeah.
a beautiful blastocyst and you put it in our uterus, and we are waiting for the results in 14 days, 10 to 14 days. The beta HCG is awaited. How much more time? Okay. So yeah, as Dr. Meenu said or Dr. Pooja mentioned that freezing embryos is any day better, but when it is about the couple who are coming to preserve their fertility, always be cautious about counseling or taking the girl in confidence and asking about any marital discord, disharmony, because if it's an embryo, then she is not able to use it later when she comes, if she is divorced by that time, because on embryo it's equal right of both the partners. So this we have to keep in mind.
But if one of the couple dies, so we have a consent in ART nowadays that the other person can claim if the
Yes.
consent is pre-hand consent is
Right.
taken. You
So
know
I'm
that.
talking about the divorce.
Divorce. Yes.
Dr. Sunita, I just want to mention a very interesting couple. They were a Japanese couple who just recently came to me, and they were undergoing a simple ovulation induction or an IUI procedure. But on the history, the girl has already frozen her eggs in Japan. And after a while, after 3 unsuccessful IUIs, so I was telling, why don't you go back and use, because you're 37, you've frozen the eggs at 32. And trust me, the answer really blew my mind. She said, no, they are my eggs. I would like to, see what I want to do with them. So she wasn't ready to inseminate with her husband the sperms, but she was wanting to keep it as her indemnity or an insurance for the future use. So that was like another eye-opener for me.
Yeah, those
That's
eggs
a
would
true
be
banking,
indemnity
yeah.
to.
So coming to the legality, for how many years you can preserve it? Dr.
Till
Rimi,
10
we are
years.
short of
10
time,
years.
So,
Yeah.
So by law, you can save the gametes for 10 years, but if you
can
have to
take a
save for
consent.
later use also, then you have to inform appropriate authorities, and you can do that. So do men also have a biological clock?
Yes.
Anybody?
Yeah, definitely.
So
they
are we worried when the men's age is maybe more than
45.
45
yes.
and
so yes, some genetic disorders are linked to increased paternal age as well, like neurodevelopmental disorder, autism, schizophrenia, even genetic disorders like achondroplasia, Apert syndrome, childhood cancers, lymphoblastic leukemia, even neurofibromatosis and Marfan's, they are linked to increased
I think
paternal
and the
age.
risk of autism also. We had
yeah,
Dr. Patki's
yeah.
talk,
Yes,
Chandigarh.
yes,
Yeah,
absolutely.
the risk of autism.
We need to tell them that
Paternal
even
age.
learning disabilities are very, very common.
And we know that men can also save their fertility. The answer is simple, semen sample can be saved, preserved. But if they are coming to at 38, then you should tell them that it is only after 45 that these kind of problems may happen, and you can give them that option. And in case the sperms are not there in the semen sample, then TISA and microtesy done for any reason, these tissues can be cryopreserved too. So if we look at ART law 2021, gametes can be frozen for 10 years. If need to be frozen for longer, you have to inform appropriate government authorities. If unmarried women wants to become single mother later on, is it permissible as per law? Yes, but single fathers are not permissible. So if anybody is not aware of this, please be aware. So this we have just taken. So what is this? These are the last 2 slides with me. What is oncofertility in just one sentence? Any of my
Fertility
panelists?
preservation for patients who are undergoing cancer treatments. It can be for both male and female. So that is
Yeah, so oncofertility, why we have started talking about so much about oncofertility is because the treatments for cancers are so advanced now. So, you know, the cure rate is increased. So that's why when the girl is in remission phase, she is absolutely cured of cancer, she will be looking ahead for, you know, getting pregnant and completing her family. So 5 year survivals for cancers have markedly improved over the last few decades. And what are the various options? If it is post-pubertal male or female, you can preserve their eggs and sperms respectively. If it is pre-pubertal, then cryopreservation of testicular tissue in males and cryopreservation of ovarian tissue in females can be done. So this is, I think, as short as possible we have done for the panel. So once in remission phase, women will have you know, the willingness to conceive. That's why we should talk about oncofertility. Being gynecologists dealing with cancers in gynecology, it is our duty to explain them that they can preserve their fertility. So once again, a very happy World IVF Day to all, and thank you so much for your kind patience.
Thank you to the panel for this interesting conversation. May I please invite Nenika from IHW to felicitate our guests. Can we please keep the applause going for our wonderful panelists?